Okay. Well, so let's take a minute to look at federally qualified health centers. And Paula, I'm going to invite you back to the microphone and ask you to give that overview if you would. And I also want to note that we have on the call two FQHCs that have footprints in DuPage. And at the close of your remarks, Paula, we'll give them the microphone if they wanted to share something to add.
Great, thank you. Yeah, I'm sure the information that they have to share is going to be more, more reflective of the services that are available currently at DuPage. But I did want to talk just briefly. Federally qualified health centers across the state are open and able to provide services to all populations. And federally qualified health centers are willing to provide a lot of enabling services to those who need them. And as far as the COVID-19 response goes, the majority of our health centers have already established or are working to establish testing sites as well. And they are uniquely able to work with many different special populations, and it's part of their mission. Similar to what was just presented before, making sure that everyone has access to care. And I think with all the changes that's happening currently, both with COVID and even your traditional visits, that we need to ensure that people have access to care, whether it's via telehealth, through video, face-to-face, phone conversations, drive-through clinics, things of that nature. And I feel like the federally qualified health centers are really stepping up to provide all those unique services. So I really encourage you to work with your local FQHC and for all of your service needs. On the slide that David had shared before, there is a testing map that IDPH has put out. So for those of you, so many of the health centers that are providing testing, along with health departments and other programs, so anyone who's providing COVID-19, the state Illinois Department of Public Health is asking for people to report if they're providing testing for COVID. And you can go to this website to see if there's anyone close to your area or to that client who's needing to be tested, and to refer them to those different locations. Because you may be seeing people who are coming from different borders around the DuPage area, or they may live visiting a family member, things of that nature. So it's important to know what the resources are, both locally and just outside of your borders, and then statewide as well. So I feel like that website will help. If you go to the Illinois Primary Healthcare Association page, we have a Find a Health Center as well link that can help you connect to a health center anywhere in the state of Illinois as well. Again, for if you're working with clients who are not residing, or you're trying to help from a distance, that would be a resource. And I can share that back with David as well, the link to the IPHCA page that can link you to a health center anywhere in the state of Illinois. But I want to turn this over and give our FQHCs who are serving DuPage County an opportunity to share the services that they're doing now.
All right, thank you, Paula. So I know I've seen coming onto the call, Brandon Pettigrew of Hamdard and Thea Kachoris-Flores of Access Community Health Network. Could I invite either one of you to share what's your sense of what's happening here?
This is Thea. I don't know, Brandon, did you want to go first, or it doesn't matter?
You're welcome to go first. Yeah.
Okay. Hi, everybody. For those that don't know me, I'm Thea. I work with Access Community Health Network, which is a network of federally qualified health centers that we have health centers throughout the city, Cook, and DuPage counties. We have 3 community health centers in DuPage. We are still, as both Paula and Melissa talked about, we are still seeing patients in our health centers for essential visits, though we transitioned very quickly to doing a lot of telehealth. And so we are available still seeing patients in DuPage for essential visits in the health center and then via telehealth for others. That also includes behavioral health services. And I know we've been, talking to this group before about our MAT services, which I know are extremely needed. And I even just heard, I think yesterday, that the death rate, even from that overdose, is going up in DuPage. And we are still actually doing our MAT services. We found a way to do both a combination of telehealth and in-person for our MAT services, including in DuPage. And we are going to be actually expanding those services in West Chicago starting next month. For our testing, I'm going to try to share my screen. David, do you need to do something, or can I just?
Yes, I stop sharing and then you do the screen share select.
Got it. I'm getting there, I think.
Yes.
Can you all see? Okay. So this is a list of our testing sites that we have up right now, and that will be up by the end of the month. All of these right now are in Cook County. For our patients that we're seeing in DuPage, we are referring them to Melrose Park. That's our closest testing site. I will say that at these testing sites, we are taking all patients. Now, they're either existing access patients or other patients, uninsured, insured, whomever. We are not charging for testing right now. And I heard today that we're going to start, right now we've been screening for symptomatic. We're going to start testing people that are asymptomatic. Which is, I know, kind of a need out there as well. So we're starting to do that. We don't have plans right now to open a testing site in DuPage, but that may come later as this all evolves. We were just trying to get the 5 up and going as quickly as we could. I think what's working well when it comes to our testing is really engaging with the community, hearing what the community needs are, meeting with community partners to let them know what we're doing, coming in, having community town halls to share with them what we're doing, and giving them flyers so that they can distribute to their constituents and clients as well. And really our focus has been to, I think, others talked about this, is making sure that we're meeting the needs of the communities that we're in and addressing the disparities that we're seeing. So, I mean, as you can see from some of these locations, we're really trying to get into the areas that need the testing and might have some disparities, and where there's some pent-up demand. And then the other thing that I'd say that's working well and that we're finding is that, and I'm going to share something else on my screen here, people are coming and getting tested and needing information while they're there. So we've developed this document that we give to people that are coming for testing, what to expect about their results, questions that they might have, how to manage while they're at home with the virus, other guidelines to give to members and caregivers, and then some of the things that we also talked about already on this call is what other resources they may need. For example, benefit assistance. So that's all I had.
Good. And as we transition to Brandon, I want to ask you, how could people access that beautiful resource that you just showed?
I will have to talk to my communications department and ask them it may be on our website. So let me find out, and I'll send it to you and I'll let you know, David.
Thank you. Thank you. And Kim Reed is asking if it's available in other languages. So that would be helpful to know also.
Yeah, usually we do everything in bilingual English, Spanish. So I would imagine we do.
Okay, Brandon, Pettigrew, I would like to ask you from Hamdard.
Yeah, so I will just reiterate a lot about what has been said about federally qualified health centers. We have a COVID testing site at our Addison clinic. I think Thea can go ahead and nod along at something, but we have services available in both English and Spanish, as well as a full service language line. So if someone were needing to have services in any other language, we would be able to offer COVID testing in any language necessary, as far as all of the primary ones, Arabic, Urdu, all of those. Our testing is, I see Kim say it, I think Thea said it as well. Testing is free for anyone uninsured, things along that. That includes any televisit pre-screening that they would need so that we can understand what their symptoms are and things along those. We're trying to make sure that we aren't creating any barriers. And I think, we happen to just be in a little bit of a situation where I don't know if I will say that we're blessed, but we've been very supported by HRSA as far as making sure that we are able to get funding and that we are able to really support that kind of testing as well. And so I do really want to reiterate that what Paula said, what Thea said, community health centers are here not only on a regular basis to offer primary and behavioral health services, that we are also continuing to offer through a telehealth and on-site service, but we're really kind of trying to be very forthcoming and very quick at making sure that we are offering all the services necessary to prevent any further COVID spread and to really respond to this COVID-19 situation that's going on. And if VNA was on this call, they would reiterate the exact same services as well. So always want to make sure that you understand that too. I think we're here as a resource. We're always happy. It's wonderful to hear, all of the services that are going on. Our health navigation services continue to be robust as well, where I think we all kind of really moved to a telehealth service, and we're slowly starting to bring some of our other staff back to deal with some situations such as needing to fax and copy paperwork to get Medicaid and ACA and all of those things dealt with. And so I definitely would say, we're trying to make it as easy as possible. And if anyone has any further questions as far as getting people testing or making sure that they have access even to just their general wellness, that all of us have open ears, and we're more than happy to answer any questions. And I do see a clicking chat bar, so I'll make sure. Yep, Arabic, Urdu, I see Persian. Testing free, yep, testing is not a problem. No questions asked. No one should feel any kind of reservations as far as people, whether they have, what status they have as far as immigration, anything like that. We don't even ask, much less would ever do anything for that. And yeah, I think we're all more than happy, and we're here to help across the board as far as FQHCs are concerned. Our address, we're in Addison, Illinois. It's 228 East Lake Street. So we're right on Lake Street in Addison.
Brandon and Thea, this is Paula. I have a question. So with your testing, are you doing some drive-through clinics? And with offering the testing in multiple languages, how are you able to do that through like a walk-up or drive-through without bringing people into the actual locations?
I'll take it first, and then Thea. So our clinic is a drive-through clinic, and I don't know how the light would work, but I could literally lift up our computer right now and show you our back lot because it's testing day today. But people just drive in, they park in a parking spot. We have a tent set up to make sure that we have all the equipment necessary out there. We go right up to the window. Unfortunately for our lab services, we do have to have some signatures and stuff like that just to make sure that we're able to follow HIPAA protocols. But otherwise, all of our providers speak Spanish. So Spanish is the easiest language for us to access as far as making sure as that's concerned. And then we also do have we're using an iPad system through ourselves that connects to Athena, where we're able to call. We use the Heartland Alliance language access line. And so, we're able to call into that. I will note we have not had a situation where we've had something other than Spanish or English yet. So we haven't had to put that to the test, but because we have pre-testing and screenings ahead of time, we would be prepared to make sure that we understand all the languages that are necessary ahead of someone actually getting a test.
Yeah, and I'll just quickly jump in. We are not doing drive-through parking lot, partly because we want to be sensitive to our communities, and a lot of our patients do not have cars. So we wanted and then Chicago weather, we wanted a place for people to go inside. So we're actually using spaces that we had. And we're also asking people to pre-register so that we know who's coming in, so we can handle that Spanish. But like Brandon, the people that we have that are predominantly Spanish speaking areas, we have Spanish speaking staff, and then we use an interpretation services where we don't.
Thank you
That's
very
great.
much.
Thank you.
That is good.